Hi, everyone. I'm Dr. Diane Hayden, and you are listening to the Dr. Diane Show, where we explore revolutionary expansion of mind, body, and soul. Each time on the Dr. Diane Show, we have experts from around the country discussing cutting edge topics on longevity medicine, natural health, mindset, and soul purpose to help you shift your perspective and become a mindset warrior like me. Today, I'm excited to welcome Dr. Nicole Kerr. She's the owner and operator of Fertility Oasis in Wallingford, Connecticut, and she is passionate about helping people conceive and take home the baby they have struggled to have. Dr. Kerr is a naturopathic doctor, licensed acupuncturist, and certified in abdominal massage through Dr. Rosita Arvigo's Abdominal Therapy Collective. She is driven to discover the true reason for a couple's unexplained fertility and recurrent pregnancy loss, especially when all else has failed. With an undergraduate background in research at Cornell University, science is very important to Dr. Kerr, though she will never overlook nature's natural power to heal and the use of remedies that have existed safely for millennia. Concerned about the future fertility of our children, Dr. Kerr has found a new interest in teaching and exposing how daily living can be negatively impacting our children's potential future ability to conceive and what we can do about it. So welcome, Dr. Kerr. How are you?
I'm well, Dr. Diane. Thank you for having me. I'm very excited to talk about this topic.
Awesome. Yeah, it is definitely something that needs to be talked about, especially I feel now more than ever. And we're going to get into a lot of good stuff. But before we get there, our listeners are always interested in your background. I find that many natural medicine practitioners and spiritual practitioners have a really interesting journey that kind of led them to doing what they do. So tell us, how did you even going from research into naturopathic medicine?
Exactly. Yes. It's not that big of a jump, but it's kind of a jump. Going through undergrad, I always told myself, I'm never going to be a doctor. It was never an interest of mine. I was all about wanting the answers, not giving the solutions. So having the answers to me is almost as important as giving a solution, because you can't give a solution, in my opinion, if you don't have a really good background on what's causing the problem. So when I wanted to go into my graduate programs, I started to look into more natural ways of research. So cancer research was a big one that I was considering. And then I stumbled upon naturopathic medicine as a graduate school. And up from where I'm from in New York, I've never heard of a naturopathic doctor. I didn't know what one was. But when I read what they stood by and how they treated patients, I was like, wow, like I don't want to do research. This is what I'm supposed to be doing. I'm supposed to be reaching people in a health way. So I guess I should become a doctor, even though in the back of my mind in undergrad, a lot of people are pre-med and everybody asks, so what's your major? I'm like, I'm getting a BS in BS. That was my answer always, because I got a bachelor's of science in biological sciences. So I always make that tongue in cheek because it's funny to me. But I never was pre-med. I wanted to learn about why things were happening and discover the reason behind things, not necessarily treat people. But naturopathic medicine had such a attraction to me. I come from an older family where we were, my grandparents were dairy farmers, so a more natural approach to life. You didn't need a naturopathic doctor. We didn't know what one was, but I still come from an older family. And that was really important growing up as well. You didn't just run to the doctor to run to the doctor. So when I found naturopathic medicine, I found my way to a school, and my first semester there, we're trying to be good, healthy people where you didn't necessarily grow up with that background. And I heard birth control was, obviously terrible for you. And so I had to I came off of that on my own. I was put on it originally for terrible menses. And after 2 acupuncture appointments, that pain disappeared, because it did come back after I came off birth control, as a lot of women can say occurs. Just because you get put on something to take the symptoms away doesn't mean they stay away when you come off of it. So there was no real true healing. It's just masking of what my problem was. But acupuncture seemed to be the healer, because after 2 treatments, my pain had substantially subsided. So I immediately signed up for the next year to get my master's in acupuncture as well. So I went from going to research cancer naturally to becoming a doctor, and then an acupuncturist on top of that, from my own ailments and the correction that I saw occur because of it. Those modalities. So
that's like I said, it's typically something that somebody was dealing with. Like I know a lot of Lyme practitioners had Lyme themselves, or if someone had dealt with a lot of like digestive issues or allergies, they typically gravitate towards that subject and, go down the path of natural medicine. But it's always interesting to me because we all have our ways of how we found our path through
Yep.
that basically, or to it. And I'm sure that your family had a lot of interesting remedies that they probably used or taught you that you just took for granted or as like normal. Whereas a lot of people, like you said, would just run to the doctor every time, get a prescription, to me, which is just slapping a Band-Aid on it because you're not really fixing the issue.
Yes. Yep. That's exactly how I felt.
Yeah. So what changed your focus to fertility specifically?
Yeah, so after graduating, you get into the realm of really general practitioner. So I was treating everything from high blood pressure to cholesterol, and a huge focus on women's health, trying to help people at that point regulate menses, get periods that are painful or that, come every 60 days under control. And then I started to want to become pregnant myself and was having some trouble. And so my own personal struggle led me. After my daughter was born, I did take 3 years off. I call it my sabbatical, but it was really just my maternity leave extended because we felt that time period is really important for the one-on-one parenting or having someone there as a caretaker. And I took that role on and I loved it. And then when I came back, knowing my own fertility struggle, knowing how people are shuffled kind of through the system and never really taught anything, explained anything. I was fortunate for my background. I knew, natural things that could assist and, improve without necessarily needing medication or drugs or, extensive treatment. I decided to focus my practice on fertility when I came back from being on my sabbatical maternity leave of 3 years, because I knew that that was necessary for me to be fulfilled, to
Mhm.
know that I was conveying and giving information to people that I knew that they were not getting otherwise.
Yeah.
That's what
And
led me down that path.
it's a sensitive topic too. I mean, a sensitive topic that I think people don't necessarily want to talk about. And, there can be a lot of like, I don't know if blame is the right word, but, pointing figures at like, oh, who's responsible for this? Why can't we conceive? Is it typically it's, most people I think it's the female, but a lot of times it can be the male. There are definitely things to look at in both areas for sure. But yeah, I think it's so easy for people to just go down this path of fertility treatment. Like it's automatically, that's just what everybody gets funneled into. And it makes me crazy because I'm like, oh, there's so many natural things you can do. Like, first of all, let's figure out, why are you struggling? Are you under a lot of stress? Are you not eating healthy? Like all these things you and I talk about, right? That some women don't even think about could be affecting it.
Yes, yes, much more affects it than we even scratch the surface of when we're in mainstream medicine. Because if it has nothing to do with the ovaries or the uterus or the cervix or vagina, then it's really kind of not looked at a lot with fertility. And it took a long time for me to feel comfortable and not necessarily ashamed to talk about it or feeling, in some way wrong, like I couldn't do it by myself or couldn't fulfill something that a woman should be able to fulfill. So that's something that I really work a lot with my patients too, is just understanding that it's nobody's fault. And there are answers. We just have to figure out and dig a little deeper to find those answers for sure. Um, so
Yeah. And I can imagine it's like, as time goes on, the stress becomes more and more. And from what I understand, like that's the number one thing, could be the number one thing of why someone can't conceive, is just because they're under too much stress. And it's like to me, it's like a catch 22, right? It's
yeah.
as it keeps going longer and it's not happening, then naturally people get more stressed out. That's what you're trying to eliminate.
Yes, and they are told by their doctors that it has nothing to do with it because it has nothing to do with the ovaries, uterus, or the cervix or the vagina, unfortunately. But there are volumes of information out there, and I love explaining this knowledge to my patients because when I feel like someone understands it or learns about it, it's like an eye opener. Most of my female patients that come through the practice are like, why wasn't I taught this in health school? Like, I don't even know about this, and I'm a female. I should know about this. So I really try to empower my patients too, to learn about their bodies, to understand what their bodies are doing. So many people know more about their computers, phones, and cars, how to keep them healthy, how to debug them, how to clean them out. But they don't do any of that for their own machine, their own, beautiful body that they have. And this is required for us. Taking a little rest is required for, the hypothalamus to talk to the ovaries. If stress is there, cortisol shuts that pathway down.
Right.
There's been documentation of earthquakes can send a woman's cycle 2 or 3 days later because that stress factor affects the sex hormones. So there is there is an absolute connection between how much stress we have, what kind of traumas we've been through, how we've been able to deal and work and cope through those, as opposed to brushing them under the rug, as many women are expected to do with so much in their lives, and men too. I mean, again, we're female centric around this fertility topic. I don't want anybody to think that it can't go both ways, because the men can have just as much stress affecting their performance or their ability to make sperm as well. So
Right. Exactly.
it's important for everyone to understand.
So when someone
Some
comes to
capacity
see,
of their body.
yeah, yeah. When someone comes to see you, typically, like, what can they expect? What's the kind of walk me through a little bit of the process.
So it is about an hour appointment, and I always reassure people that they will be getting plenty of information post appointment, because what I like to do is listen to them, look at them, see them. There's so much that can be told by just someone's presence. You don't even have to necessarily get deep in their history, but of course you have to in this situation. So I do a thorough investigation of their family history, their history with inability to conceive, how long they've been trying, how many losses they've had, if they've gone through reproductive advanced therapies like IVF or IUI, any kind of outcome for any of that. And when I take that big picture, then I can start narrowing in down on more specifics that other practitioners may not think of, because it's not within the realm of fertility per se, but certainly impacts fertility. So some very basic Quest tests I would run to make sure that they're nutritionally supported. Iron and vitamin A are very commonly seen to be deficient. Even though we live in an industrialized first world country and everybody says there's no way we can be deficient, we have 25% of Americans deficient in magnesium and so many more deficient in potassium. So really looking at the basics of the function of the body is necessary to know whether or not a child or a fetus will hold and the body is capable of wanting, even. Because if you're deficient in major nutrients, the body's not going to steal nutrients from you necessarily to make a baby. It will steal it from you once you have a baby made. So that's where we need to make sure the mom is really plentiful with these nutrients. So it's about the Quest tests, and sometimes I'll do specialty tests like a DNA fragmentation for the male aspect. When they just keep having miscarriage after miscarriage, usually prior to 10 weeks, you really want to see what the quality of the sperm is, because they can be dressed up in a nice little pretty, outfit. That's what the semen analysis is. It's the way it looks on the outside. And we know how many people walk around and are hot messes on the inside, but they look great on the outside. So the DNA fragmentation really goes a little deeper and looks to see if the day-to-day environmental stuff that the person's getting hit with, their caffeine intake, they're, cycling on a bicycle for 20 miles a day, how is that affecting the DNA within the sperm itself? So those are different tests that I would run and send off to. And then usually over a 3-month period of time, we're developing the protocol, because we have to look at sex hormones at certain times. We're fixing nutritional deficiencies. I tell most of my patients, don't expect to get pregnant in the first 2 months, because we're trying to help the body recover and heal. I really try them to go 3 months, but when people have struggled as long as they have, because we wait, unlike our cars, I like to use analogies, unlike our cars, we don't wait for them to break down usually to go get their oil change, make sure their transmission fluid's good, but we literally wait until our body is screaming at us to go get it fixed or to go get it checked out, or even just to listen to it, where we should be tapping in on a daily basis. Like, okay, what's my mind feeling today? What's my heart feeling today? How's my body? Is my knee hurting again today? Like, go through the checklist, check in with your body, and it will give you so much more in return, because you're showing it that you care about it.
Yeah, 100% agree with you. I mean, we're on the same mindset, obviously, about all of this, but yeah, I totally agree with you. It's like the last thing that people think of, it's just crazy. It's almost like, and I think it's because our bodies are so amazing that we really can push ourselves so far, and the body will keep compensating and, sending little signs, but we don't necessarily always listen to them. But yeah, so we can, unfortunately, sadly, a lot of people go a long time because they may not even be aware of pain, or they may feel like, more often, I think it's that people feel like, oh, well, I'm just getting older, so this is normal. I hear, so many people say that. Or it's like a fact of life. Well, my mother had this, this, that, and the
Mhm.
other thing, so I'm going to have it. So it's just, they just accept it
Yeah,
as if there's no other option.
right.
And there are so many other options. And it makes me crazy that people go to all different kinds of practitioners before they go to a naturopath. I say this all the time. That is the first doctor you should see, in my
Yes.
opinion, always.
Yes.
Seriously.
Yes. It is, it's just an eye opener when you see what people come to you with that wasn't identified by their mainstream doc that could be contributing. Like I said, I've had recurrent pregnancy losses and I run their thyroid antibodies and they're raging Hashimoto's and their docs never even thought to look at that. And I'm like, so,
Yeah, you're like, really?
right? Really? It's kind of a basic thing.
Yeah. I love what you said, the part of your bio that I read, about your concern with future fertility of our children and how basically teaching, things that we're doing in our daily life and how that can negatively impact. So let's just talk about that a little bit, because I know you're passionate about that. And I want to make sure you have a ton of knowledge that we get that information out to people. So anywhere you want to start with that.
Right. I just had a thought on the last comment that you made that kind of tied into this one, but my brain is in that sympathetic system right now. So it's not getting that neuron connecting at the moment. But for me, a lot of the stuff that people come to me with problems, they excuse it because they've been told by their doctor it's not a problem. It's easily excusable when you see something around you all the time. It's easily excusable to think it's not going to impact you when we live in a capitalistic world that everybody's trying to make a profit off of you in some way. And there's so much around health that's excused when it's the basis of where we're headed, of chronic disease, infertility, massive amounts of behavioral issues in our children. And then when I try to talk to people about it, they look at me very confused because it's common. It's common. So it must be okay.
Mm-hmm.
My daughter is one of the biggest drives for me, and seeing her peers and understanding where they're at is just, it's saddening to me because we aren't educated on the basics. So one of the major things that I see is happening is like our poor girls are thinking that they need to get into all the cosmetics and all of these things that are true disruptions to the endocrine system. So the endocrine system is a group of organs that excrete certain hormones, and there are chemicals that are plentiful and unavoidable in a lot of situations, and we think they're common, and so they become innocuous and they become non-problematic when they are literally creating so many problems in our world. So get rid of the candles, get rid of the air fresheners, get rid of the really, really smelly fabric softeners. And I know that people are like, well, why? If it was harmful, why would they allow it into being marketed? And that's
Yeah,
my
that's the
question.
$1 million question.
That's my question. So, seeing more and more of this and understanding the disconnect between people realizing that just because it's there doesn't mean it's good. Just because there doesn't mean it's not harmful. Just because coffee now is on every corner, across from a corner, you have 4 of them, doesn't mean your sperm can, I say this all the time, America runs on it, your sperm don't, okay?
I love that.
Yes, sperm don't. And there are actual genetic mutations that you can have in your body that make it even more detrimental to have 800 milligrams of caffeine in a day. So you have the power drinks and all those things that are full of stuff, and we think that it's okay because it's on the shelf marketed to us as safe, and it's not. And so that's my new kind of passion project, where I'm going to start creating educational information, because for me, again, my daughter is my driving factor, and her peers are going to be important to me because they're going to be important to her. And I want them to understand and know, and I want mothers and fathers to know we're far, far, far ways away from where we were 100 years ago when it comes to the saturation of chemicals, the poor food products. Again, we want to make sure that we don't put diesel in our cars that take ethanol, but we're going to put saturated fatty acid 6 in plentiful amounts, which our bodies actually get hardened, and our arteries get junked up, for lack of a better word, because of these foods. But they're plentiful, and it's what's available, and that's what people go for because it's affordable, and it needs to change, in my opinion, for a healthy future. Yeah,
Oh, totally.
out of the 11 industrialized nations, we are last in healthcare. So that's kind of a sad state of affairs, in my opinion, when we're a powerhouse country, that we literally are dead last in the 11 industrialized nations for healthcare. So my focus now is more about wellness, not about, I'm kind of shifting my brain set from being a doctor and doctoring, because to me that has a very specific look to patients and people. And that isn't necessarily how I'm proceeding with my practice, because I'm not just going to hand you a pill. I really want to find the root cause, and I want to educate. Yeah.
Yeah. I love it. I mean, oh my God, there's so many topics we could go down a road with
Right.
everything that you just said, because it's all amazing information. And it is sad that, there's so much marketing out there towards garbage, quite honestly. And people don't understand, like they don't realize, even if you go to Whole Foods, I remember like one of the first times I walked into Whole Foods, I literally thought, because of the marketing, oh, everything in here, I can buy anything in here. It's going to be good for me. Totally fine. No crap, blah, blah, blah. Yeah. Okay. I'm a label reader. So, luckily I have the education and the ability to do that. And I know what, bad ingredients are and that kind of thing. A lot of people don't. There's a lot of education that needs to go around that. But I was like shocked about some of the stuff on the shelves at Whole Foods. And I'm thinking to myself, if I'm shocked, it's like there's no way the majority of the people in here have any idea. Like literally, they think that, oh, I'll just, go whatever's here is good because it's Whole Foods.
Yes.
And there's a million places like that. And it's just the marketing of, the low fat craze. Remember when that came out? It was like, everybody was like low fat. Well, look at some of the ingredients that are in those products. I mean, pretty much I tell people just shop the perimeter.
Right.
And even then it's sometimes sketchy.
Yeah, right. Exactly.
But
And the hardest thing working with the group that I do, because they already feel so much shame and guilt, is the blame that can often be associated with when I start talking about these things. It is 100% not our fault.
right.
It is the people's fault that's allowing the crap on the shelves to begin with. So I like to point that out. I'm so compassionate with my patients, and then I start having diarrhea of the mouth of everything I'm disgusted with allowing these things. So if we can just open our minds to understand, don't blame ourselves. We really need to be advocates for what's best, and don't say that we need these things for people to be able to eat. Because if you look at, the dollar chains, there's rows of garbage. And if you just think of the amount of money spent on the plastics that make the canisters to hold all that, we could be growing really great food for people, or at least subsidizing their food in some way. So the blame is something that I need to make sure people never hold on to, because that will also make them ill and sick in other ways.
Right.
Yeah.
Exactly. Yeah, exactly. It's a lot, it's a lot when you're struggling with a health issue, whether it's infertility or really anything. And then now you also have to figure out, oh my God, how am I going to navigate even grocery shopping now? Because I had no idea that this stuff was bad for me. I had no idea that candles were bad for me. I mean, what do like I'm just watching the commercials and that's programming me to buy
Yes.
this, that, and the other thing. But hey, candles smell nice. Like, how could they be bad? Yeah, it's crazy when you think about everything that we eat, everything we put on our body, all of the topical stuff, makeup, lotions, body care. Now it's the things we bring into our home.
Yep.
It's a lot. It's a lot. And I can see how people would be totally overwhelmed and, start to play that blame game. But when I talk to people, I think I try to get them to do like one thing at a time. Each month, just pick one thing that you're going to learn about, or eliminate, or, do something different in terms of it being healthy.
Absolutely.
So I don't know if like any other tips that you have for people that try to not be so overwhelmed about, making a lot of these changes.
Yeah, I always tell my patient, at least I try to be supportive in the fact that I'm not looking for you to upheave your life. I want you to add things in before you take away, because that's a much calmer on our nervous systems and our ability to think things things through and be like, okay, yeah, I'm not having to take away gluten, wheat, dairy, soy, and all these things. I'm going to add in to make sure I get my 4 cups of vegetables a day, really good clean leafy. So talking about the things to include before exclude is, to me, really refreshing for patients and allows them better navigation through what I'm expecting of them. I don't know if that answered your question
Yeah,
on that.
no,
Yeah.
absolutely. And I love that because I think also what that does is as you add more healthy items in, you probably start to eliminate some of the not so healthy things just by virtue of if you're adding in 4 cups of vegetables, that's going to fill you up. You're probably
Right.
not going to need to reach for a snack or
Exactly,
something.
right. Yeah, the big one that I do with a lot of my patients, all my patients get a eye mask. The new patients get an eye mask because of how important the dark light cycle is to our hormone cycling, especially our FSH and LH. They're 100% registered off of the light that we get into our eyes. And so making sure that it's very dark at bedtime is, so that's an inclusion. I'm not telling them turn off every single electronic in your bedroom that has a little light on it. Just put your eye mask on so those little lights aren't bothering you. Of course, I talk about the internet and not having that blue light in your eyes, right? Up to the point you want to go to bed, because that's really detrimental to the making of melatonin. And again, that cascades into your sex hormones. So adding in things is much better in the beginning than overwhelming with removals.
Right. Yeah, I totally agree with that. So what would you say is your biggest pet peeve or biggest hurdle in just your profession or what you have to do?
I actually wrote one. I wrote one down for this one. It's called unexplained infertility. That's my biggest hurdle and my biggest pet peeve. Yes, there are some times that we don't understand what's happening, but if we look at the bigger picture, it's often able and capable of being seen. Or if we don't just limit our investigation to, like I said, the sexual reproductive organs or the two endocrine, the thyroid and the adrenals are sometimes discussed, but usually not by, an advanced reproductive place. They're going to be like, okay, your eggs are here, your sperm is here, let's put them together. So yeah, the unexplained, I call it unexplored. I've written an article before about, unexplained or unexplored, because I just think it's not digging necessarily deep enough. And that can be really disheartening for a lot of patients. Like I said, I have patients come into me and it's unexplained. All the sex hormones look good. And it's the first thing I run is their vitamin A and iron. And it's like in the gutter, or people that have had past mono and they're literally describing crushing fatigue to me, and nobody's investigated it for 2 years. I'm like, well, let's look at your EBV, which is Epstein-Barr, which is known to cause mono and can reactivate. And hers are showing numbers of reactivation. So it's like, it's not unexplained, it's unexplored. And that's where I think my research cap is really important. I have a lot of placental issues. Women will get pregnant and the placentas just don't uphold. I go on my beautiful PubMed, which is research from peers of medical reviews, and it's their science. I love it because I say it's theirs because I'm not in the research anymore. So it's their science, but they're proving that it's more than just the reproductive organs. This whole study was showing how chemical in sunscreens can actually be causing this placental issue in pregnancy. And it's just, nobody's ever going to talk about that. But because I don't give up, I dig until I find answers. These are the types of things that I discover and I want to share with people, because there's so much knowledge out there that we have research for, but it's never utilized. It's never put into the public, because what is the public going to do with it? Or what's science going to do with it when it's a natural therapy and they can't patent it and make money off of it? So my biggest hurdles, like I just mentioned, those would probably be it, is the unexplained, and then just not doing any investigation further than, what they do in the IVF.
Yeah. There's a million reasons why that information is not out there. And you and I both know what that is. And it,
Yes.
unfortunately, a lot of it boils down to money and big
Oh,
corporations that don't want that information
Yes.
out there because there's a reason. They want you on pharmaceutical medications and
Yes.
eating the crappy food and whatnot. But
the
that's,
patients appreciate it. When I say, look, here's a study that is exactly what you're in, a fetal maternal ward of extended research at this amazing, Ivy League school. This research says fish oil will help it. Please just try some. And she takes it to the doctor and yeah, I guess it would help, maybe. But here's your science saying that this could be causing her, reoccurrent pregnancy loss, but you're just gonna,
right.
Fish oil might help.
Yeah.
Okay.
Well, at least they didn't say, no, don't take that. It's going to hurt you.
Exactly.
That's happened too.
Yes.
But, at the end of the day, I kind of feel I give a lot of traditional medical doctors a little bit of a pass because I feel like in some respects, they don't even have the time to do this research. I mean, you would have to and some MDs have. Deanna Sharon's a great example of somebody who took her traditional practice and completely changed it around to an integrative functional medicine practice.
Yeah.
And it can be done, but it's, you know, it's huge. And I think a lot of them just don't have the time, the money, the energy. They don't even know where to start.
Yeah.
And then there is a group that just doesn't believe it. So, you know, those are the ones that I kind of hold more, you know, blame with.
Yes,
But
absolutely. Yes. And I've had those too, where the doc will completely just say, go off of all of that. And that's up to the patient, but that puts them in between a rock and a hard place as well. So that's where I like to have studies and research for them to be able to take and educate their docs. So some docs really don't want patients educating them. I think it's important for the hurt and desperation that a lot of these patients come to me with, because they've been trying for so long and nobody is looking or investigating anything other than just hitting them with the same stuff over and over.
mm,
It's just disheartening. So
yeah.
hopefully I can give you some hope.
So if there's one message or thing that you really are passionate about educating
Mm.
women about, whether they're moms, about their children. I know, you know, what really interested me was thinking about the children's potential to conceive. Like we're talking a lot about just the individual, like, you know, women who are of childbearing age, but what's really going on with girls that are, you know, 4, 5, 6, 7, 8, 10, 12 years old, that what are they doing now or not doing that potentially is going to have a huge impact on that?
Yes, so nutrition is going to be a huge one. That's going to impact, I feel, their fertility in the future. That needs to be addressed. Again, having a daughter now in an age of, you know, prepubescence, uh, and hearing of friends that are very, very limited in their food choices, you know, it's disheartening to me to know that they're missing out on a lot of really necessary nutrients. I think people look at food as a luxury now and don't look at it as a necessity of fuel. They don't look at it as, I need to make sure I'm getting this amount of, you know, one thing and this amount of another. And the girls are being taught that this is acceptable, or that these foods aren't necessary. And the other thing is just having some kind of sense of self. We need to instill in all of our kids some idea of sense of self. And I think that a lot of parents need to first find that. And I don't know where that disconnect had started. Transgenerational stuff is really interesting to me now as well, when it comes to, you know, if your grandmother was on birth control and your mother was on birth control, how does that impact you now? Because it does have an epigenetic change on the DNA. So those things are interesting to me to know, like these 4 and 5 and 6-year-olds, if their moms had been on it, are they going to be delayed with their cycles? Because the brain has now, you know, genetically altered, the genes have genetically been altered to not cycle. So these are the things that in the future I'm very passionate to look into. This is where I think I might get back into some kind of a research, even if it's just survey research, to find out how detrimental these things have been, to teach people what not to do. Because the longer we allow this to happen, the more changes are going to occur. And it's disheartening to me, but in my mind, I just see the future and I got to change that, because manifestation is a thing. It's like we're going to be in Wall-E, the movie, and we're just going to be all like, no bones, just plentiful, you know, adipose tissue on our little, you know, chairs going around ordering our food from a button. Because our genes are changing to the point that they don't know what to do anymore naturally, like what we historically knew how to do for our bodies. So to me, I think just having self-ownership, another thing, people don't like to take ownership. They want to blame, which I know I sound like I'm blaming as well, but I'm not blaming the people. I'm blaming the institutions. The institutions are where this change needs to start, for sure, hands down. Nothing can change if the institutions keep making common things look normal. Common and normal are two different definitions. And we're making so many things that are common now to seem normal, and they're not. So that, I think, is the main thing for the littles coming up, is just educating them on self-awareness, self-ownership, and natural living. It's just natural living, how we're supposed to interact with our environment.
Yeah. I think epigenetics is fascinating. Seriously, I have like a really quick story. And for anyone who's never heard of this before or might even doubt, like, well, how could my grandmother affect what I'm, you know, what she ate or did or whatever affect me? My college roommate, her dad was a marathon runner. And that guy ran marathons till he was like 90 years old. And he ended up, living till he was like 92. And she, by the time she was not even 50, had to have a double knee replacement. And she never was a runner.
Wow.
She did like aerobics, and she was into fitness, and she did do sports and things like that. But I remember I was talking to I think it was either a chiropractor or it might have been an orthopedic doc about her situation. And they were like, there's no way she needs a double knee replacement. Let me look at her scans. Like, there's just no way she could be that young and have, and unless she was like a football player.
Right.
And the guy couldn't believe it. He was like, oh my God, yeah, she is like bone on bone. He's like, I wouldn't have believed it unless I saw it. And I said, you know what's really interesting? Her dad was a marathon runner. And he's like, totally interesting. It's almost like that he didn't have any problems in his life, but he passed that genetics onto her.
Right.
It's crazy.
Yeah. I mean, one in the reproductive world is diabetic dads having PCOS daughters, because PCOS, polycystic ovarian syndrome, is really highly driven with insulin resistance, insulin issues, sugar issues, or testosterone. So dads that were diabetic had these issues epigenetically changing their DNA. The daughter has half of his genetics. So there's a high incidence of PCOS daughters to diabetic dads too.
Interesting. Yeah, it's fascinating for sure. For sure. Well, this has been awesome. I want to make sure people know how they can reach out to you or learn more about you. So any information you want to give to our listeners as far as website and ways to contact you.
So fertilityoasis.com is my website. Fertility Oasis on any of the social media, Instagram, Facebook. Fertility Oasis contact at gmail.com is an email that can get you connected with my office manager if you're interested in setting up an appointment. 203-265-0459 is the number as well if you choose to call. I do have a meet and greet form on my website. I do actually have a consultation with all of my patients before I take them on as clients, because I don't think it's fair for you to come into an office visit not understanding necessarily what I do or my expectations of you, because I'm a facilitator and I help you heal yourself. I will guide you and give you what will help you, but I always do a meet and greet. So if you want to get on the website, that would be an easy way to contact me, and then my office manager would be able to reach out and set that up too.
Awesome. Cool. So that's fertilityoasis.com.
Yes.
And I want to thank you for all the great information, Dr. Kerr. This has been awesome. And I hope that people will reach out and learn more, because you certainly have a wealth of information around this subject, and it's definitely education that people need.
Yes. Thank you so much, Dr. Diane. It was great to be here.
Awesome. Awesome. And everyone can learn more about us at www.naturalnutmeg.com. Actually, Dr. Kerr's written numerous articles for us. You can go in the search tool and just type her name in and pull up all of her articles that she's written for us. And I hope everybody has a great day, and we will see you on the next show.